And this brings us to the next critical dimension and our next guest speaker, which is refining the techniques and mastery of the new technique. So it's truly my greatest honor to introduce Professor Shoji, who we've been following his work for a decade. And he really has led the wave into what will become essentially the contemporary way to use HIFU with directional compression. Professor Shoji is the chairman of urology at Tokai University of Medicine in Japan. He is the recently elected president of the Asia Pacific Prostate Society and internationally renowned for his contributions to advancing HIFU techniques. Today, this morning for him, he'll share his work on directional compression, a refined technique that enhances targeting, precision, and increases efficacy. Professor Shoji, the floor is yours.
Thank you very much. Good evening, everyone. So it is great honor to receive the great opportunity to present my experiment sharing with you. So today's my presentation is refining precision, advancing HIFU outcome with directional compression techniques. Next slide, please. This is my COI disclosure. This presentation is supported by SonaBlade couple. Thank you very much for the understanding. Please, next slide. So HIFU produces ultrasound waves generated by spherical transducer delivering ultrasonic energy to pinpoint force millimeters in diameter. Next slide, please. The thermal and mechanical effect of HIFU destroy targeted prostate tissue. Please, next. This slide shows the intraprostatic tissue thermometry. This is a temperature, and this is a treatment time. This line is a treated area in the focus area, and this is an untreated area. So you can see the distinct margin between the treated and adjacent untreated area is observed in the prostate treated with HIFU. Please, next. So these characteristics make HIFU an attractive therapeutic, So attractive therapeutic modality for focal therapy of the prostate and aim to cure while preserving continence and erectile function. Please, next. This is my agenda of this presentation. At first, so I would like to introduce my experiments of foreground HIFU. Next, please. And next, please. So we reported the clinical result of foreground HIFU at our institution in 428 cases with median 60 months follow-up. Please, next. This slide shows the biochemical disease-free survival of the patient who were treated with whole-gland HIFU for localized prostate cancer in low, intermediate, and high-risk group according to dynamic risk groups. You can see the long-term outcome is not so bad, especially 6 years outcome. The biochemical disease-free survival in low, intermediate, and high-risk group were 80.4, 70.5, and 79.6% respectively. Please, next. So, however, we had key considerations in focal therapy with HIFU. So that is prostatic swelling. So during intraoperatively. So this amazing transrectal ultrasound of the prostate before the treatment and after the treatment for anterior zone in same patient. This is a sagittal image and axial image, sagittal image, axial image in same patient. Next slide, please. So we measured and reported the prostatic swelling and shift during HIFU procedure. So during the treatment for anterior portion, median 25-minute treatment, median shift was 18%, and the median shift, median swelling was 18%, median shift was 3.7 millimeter. Next, please. So this slide shows the histopathological findings of prostate cancer tissue immediately after HIFU. So we diagnosed coagulative degeneration of the prostate cancer tissue involving gland and vessels with diffuse stromal edema. This clearly bright area is diffuse stromal edema. Next, please. So how can we control intraprostatal prostate edema? So we thought. So next, I would like to introduce development of techniques of the treatment of focal therapy with HIFU. Please next. So we came up with compression stocking for the prevent edema. You can understand like this. Please next. So we started the compressor prostate from the rectum by the HIFU probe intraprostatally, so-called compression method. Please next. So we compare the change of the prostatic swelling and the interprostatic point shift between conventional and compression method. So we reported in the International Journal of Urology. Please next. So this slide shows the probe shape of the compression method and conventional method. So in compression method, balloon was expanded by the water from 80 to 200 milliliter. Next, please. So in conventional method, so during the treatment for anterior portion, in compression method, median swelling was 21% and the median shift was 4.0 millimeter. On the other hand, in compression method, median shift was 5.3% and the median shift was 2.0 millimeter. Please next. So even a few millimeter of shift can significantly affect focal accuracy. So I would like to summarize the impact of the compression method. The compression method suppresses the prostatic swelling and shift during HIFU treatment. And the compression method reduces vascular flow in the prostatic plexus and helps minimize the heat sink effect. And compression method reduces a high propagation path, resulting in a higher intensity at the focal site to promote cavitation. Please next. So I would like to introduce my clinical study of the focal therapy using HIFU with intraoperative compression method. This slide shows the inclusion criteria. So PS level was with and less than 20 nanogram per ml. And significant cancer was diagnosed with MRI transfusion image guided target biopsy and 12 course systematic biopsy. And significant cancer was located within the left or right half or upper or lower half of the prostate. Please next. So I would like to show you the technical chip of directional compression technique. Please start the movie. In the compression method, prostate is compressed transrectally by expanding probe. The Bolus guide is particularly used during this process. The Bolus guide is an attachment that can be easily mounted on the probe. So with the Bolus guide, the probe expands direction that circumferentially compress the prostate rectal wall. But with Bolus guide, so compression is directly direction to the prostate. So I show you the prostate compression process. The water inside the probe cover is increased using syringe like this. Now compressing. And this slide shows the before the compression and after the compression and adjustment in the sagittal image. The pole position is finely adjusted to align the transducer parallel to dorsal surface of the prostate. This is very important. This should be parallel. On the actual image, position of the probe is also adjusted so that transducer is parallel to the dorsal surface of the prostate. Okay, next, please. Oh, next slide, please. Yes. So biochemical recurrence was defined as Phoenix Astor definition, and pathological recurrence was diagnosed with MRI fusion targeted biopsy and systematic biopsy at biochemical recurrence. Next, please. So this slide shows the patient characteristics of the clinical study in 240 patients. The number of low, intermediate, and high-risk group were 51, 107, and 82 respectively. Please, next, please. So I would like to introduce representative cases using directional compression technique. Our first case was 68 years old. PSA level was 6.86. So MRI transfusion image target biopsy and 12-core systematic biopsy detected prostate cancer with Gleason score 4+3 and 3+4 in left lobe. So we performed left hemi ablation using HIFU with DC technique. Directional compression technique, we call DC technique. Okay, next, please. This slide shows the contrast enhanced MRI at 2 weeks after treatment. In actual image, the very clearly disappearance of the blood flow in the treated area. And this slide shows the sagittal image of the prostate. And this is bladder, pubic bone, and rectum. So this line is very clear. So PSA level was decreased to 1.02 at 3 months after treatment. So PSA decrease rate was 85.1%. Next, please. Oh, so please. Okay. So in the first 100 cases, routine follow-up biopsy was performed to confirm the treatment effect at 6 to 12 months after treatment. The adenocarcinoma was changed to fibrosis in all patients. However, recently, the routine follow-up biopsy was avoided in the patient whose Pilar's category less than 3 and PSA density less than 0.06 nanogram per ml after focal therapy based on our result. Okay, next, please. This slide shows the oncological outcome is our clinical study. So decrease rate of the PSA level were 73, 81, and 83% respectively. The pathological recurrence was 87.8, 8.4, and 8.5% respectively. Of these patients, the number of repeat focal therapy with pathological failure were 2, 5, and 2. So finally, radical treatment-free rate, so such as radical prostatectomy or radical radiation therapy, was 96 and 94 and 95% respectively during this follow-up period. Next, please. This slide shows the complication rate. The occurrence of ulceral stricture, UTI, transient urinary incontinence, and severe erectile dysfunction were 2.9, 1.7, 1.3, and 24% respectively. Please, next. So I would like to introduce my take-home message. So directional compression technique would contribute to improve the clinical outcome of the focal therapy with HIFU. By understanding and implementing the HIFU-specific technique chip, we may be able to achieve both treatment efficacy and safety. Thank you very much.
And this